Send us your story and a picture if you don't mind, and we'll read some out a little bit later.
I bet there are some great ones going to be sent in. Now, with winter on the way, it's that time of year that all hospital staff dread.
Yeah, here's Justin on the small steps that they're taking that could make a big difference in the coming months.
It's 9 a.m. at East Surrey Hospital in Redhill. Like other hospitals around the country, staff here are preparing for another busy day with a new way of working that they say is making the hospital more efficient. In the past, efficiency was not a word you'd associate with this hospital because it was one of the worst in terms of NHS standards. But it says that is changing because everybody here is now being asked to think small. To see what difference that's making, I'm taking a tour. First stop, it's the staff handover or huddle in the Newdigate ward.
So it's Monday today, so anything anyone learned last week that we want to share?
Previously, nurses, consultants and therapists ran through each patient's whole treatment plan. But now they just discuss immediate needs, which means less time in the meeting room and more on the ward.
Our huddles now last between 7 to 11 minutes, which gives us an extra 20 minutes easily every day. We've also adapted the huddle that we do at the end of the ward round, which again has saved us another 20 minutes. So we've got 45 minutes extra in the day to just physically spend time with patients, just by adapting what we do.
And that's not just you, the consultant, it's the entire team.
It's the entire team.
This is just one of the many time-saving changes put in place as part of a pioneering new programme introduced here and in 4 other UK trusts. But according to Director Sue Jenkins, it's not just management coming up with the ideas for these changes.
The ideas come from our staff across the whole organisation, from apprentices and students to consultants and executives. Staff know what works, they know what doesn't work. So it's small changes which have made really big impacts for patients and staff.
It's all very well to say, make all the small changes. What about the big stuff? What about, cutting your drugs budget, changing the structure of the hospital to make things more efficient, that kind of thing?
We talk about looking at an inch wide and a mile deep, and that's the level of detail that we look at all of our processes. And all of those added up sort the big things out.
One simple idea that staff say has had an enormous benefit is the creation of a one-stop shop treatment pack for patients suffering from the symptoms of stomach flu. Amanda Becker is a nurse on the acute medical care unit.
So Amanda, how have you made things more efficient?
So we've created a pack which has got every item in it that we need, and these are easily available for the nursing staff in a store.
So everything you need to clean a patient up and get the bed back.
Everything is in here.
Before this package was introduced, staff had to travel round the ward collecting the different items needed to look after someone.
It saves 6 minutes per patient.
Now 6 minutes doesn't sound much.
It does if you've got 44 patients on a ward, and individual patients may have diarrhoea several times a day.
So whose idea was it to do this?
It's actually a nursing assistant and student nurse that came up with this idea.
So an assistant and so in a way the most junior nurse of all. So the changes are having an impact across the hospital, but it doesn't end there.
In the fracture clinic, they're pioneering a plan to keep patients out of the hospital altogether. Consultant surgeon Murali Bhatt now assesses in advance whether patients like Helen, who's suffering from an injured shoulder, need to see him in person, or if they're suitable for a virtual clinic where they receive physiotherapy via an online video.
They're able to click on that link and see these videos, and provides them with much more information about rehab than if they came to hospital.
And what about recovery rates? Do they recover as quickly?
Oh yes, I mean the rehab is starting tomorrow, as soon as they receive this information, as opposed to in 10 days' time. By not bringing these patients in, we have other patients with injuries that require surgery who wouldn't have come in that early. We've opened up slots for them.
I didn't have to rely on anyone getting me to a hospital because I couldn't drive. It was convenient for me because I could do it any time of day when I wanted.
Elsewhere in the hospital, they've created a specialist ward for the frail and elderly. It means they can avoid A&E, and instead of staying overnight, now 84% of them are treated on the same day. All this means that in just 8 years, East Surrey has gone from being one of the worst performing hospitals in the UK to one of the best. And the team here is now sharing what they've learned with other hospitals across the country.
It's been really interesting to see the effect that small changes can have in a single hospital.
But with costs rising across the NHS and winter around the corner, will these small changes be enough to make the big difference the health service really needs?
It's really impressive, though, isn't it?
Yeah, on the face of it, they do seem like simple things, but actually when you put them all together, let's just hope
Making
that...
a huge difference.
yeah, just
OK,
make a
we're going to go
difference in
back to
the
All Things Blue. Peter.